continue from the point where we had stopped in the previous session. The next of the method of assessment of the patient's fitness is the SARA. Now, SARA again word is often misunderstood and there is always a confusion. But primarily, SARA assessment is about assessment of the fitness of a person, whether that person is fit to face the stress or not, and that also would be a suggestion of maybe the disease, resistance to the diseases, right? Now, that saras could be saran, smriti, bhakti, prajna, shaucha, shauryopetam, kalyanabhinivesham, sattvasaram, dhyata. The saras are again classified into 7 categories, and those are one sattva-sara. In the sattva-sara, the person would have a personality where he will be having behaviors. Behavioral personality is visibly seen in terms of memorizing, intellectual, and because he is an intellectual, he will be following all the healthy habits, and he will be always following the healthy habits, and such a person is called as Sattva-sara. And the next is the Shukrasara. Shukrasara is Snigdha Samhata Shweta Astidhantanakam Bahula Kama Prajam Shukrena. A person who is having a very strong physique and his appearance is quite good, like the teeth are absolutely white and the nails also are fine, and who has a higher potency, sexual capacity, he is considered to be Shukrasara. Agrasham Uttama Balam Snigdha Gambhira Swaram Saubhagya Upapannam Mahanetram cha Majja. Majjasara person would be not so obese or not so thin, somewhat in the middle, and his strength is good, and his voice is deep and very resonant voice, and he is healthy, his eyes is bigger. Such a person is called as Majjasara. Mahashiraskandam Dharadanta Hanustinakam Astibihi. Astisara person is having a relatively bigger skull, and the shoulders also are wider, and his teeth and the chin of the body would be quite prominent. Such a person is called as Astisara. Snigdha Mutra Sweda Swaram Brihat Sharira Ayasa Asahishnum Medasara. Medasara would be having a relatively more humid or more oily content in the urine, and he sweats more, and his body is quite obese, and he is not able to tolerate the stress as such. That's Medasara. Achidragatram Gudhasti Sandhim Mamsupridanja Mamsena. A Mamsara person would be having the very relatively smaller openings of the body, like mouth and eyes, all of them, they look to be smaller, and all his bony prominences are covered well with the thick obese tissue. So Mamsara is actually obesity sort of things, like Snigdha Tamra Nakhanayana Talu Jihvosta Panipatadalam Raktena. Raktasara person would be sweating more, the limbs would be looking red, nails also would be looking red as such, or every part of the body would have that reddish reflection. Such a person is called as Raktasara. Suprasanna Mrutva Gromanam Tvaksaram Vidyata. The Tvaksara person would have a very delicate skin, soft skin, and the hairs also would be quite soft. Yesham Puram Pradhanam Ayus Saubhagyayoho Iti. Now, sequentially, the persons would have better tolerance to disease, and they will be stronger. From Sattva-sara, Sattva-sara would be the highest, and gradually that capacity to tolerate would be diminishing to the Tvaksara. Tvaksara person would be more prone to diseases, would have a lesser resistance. Now, this is about grading of the fitness in the different sorts of the fitness. In the present situation, you will always have many issues related to the fitness, and that physical fitness as such is defined in the contemporary issue as the physical fitness is the ability to carry out the daily tasks with vigor and alertness, and without undue fatigue, and with ample energy to enjoy leisure time pursuits and to meet emergencies. This is what Harrison Clark has defined as physical fitness. Now, when we say a physical fitness is the definition involves all these issues. It's not only about the physical strength, it's about the capacity to do the normal activity and they live in a healthy condition as such. The same Visheshataha Anga Pratyanga Pramana Asasaratah Pariksha Ayuhu Sunipuno Bishak Siddhyati Karma. So Now, to predict the expected life period and the possible outcome of the disease treatment, you have to go for the Anga Pratyanga Pramana Pariksha and the Sara Pariksha. Both of them would give you a comprehensive idea about the possible fitness of the patient. Now, in the contemporary situation, in the medicine as such, that fitness and is one of and certifying the fitness is one of the responsibility of a practicing physician, and certification of the fitness would be again a very complex issue. It will depend upon many of the situations, like the very common fitness for surgery. Now, when we deal with in the clinical practice, the fitness for the surgery, when a person is going to join a institution, they want to have a fitness certificate. They will come with that. So criteria for the fitness for each of these jobs would be different. Of course, the maximum fitness required would be when you join the army. And for a practitioner, you'll always come across this issue, somebody coming to you, some of your known patients coming to you with a form where you have to certify that this person is fit for a specific job. So fitness for that specific job should be known, and this would be defined. So that's another complex issue which we have to evaluate. Fitness for insurance is another issue which we commonly come across. Fitness for joining army-like conditions is another issue. So I will not go into all the details of these issues now, but I will be picking up only a few of the issues. One, the fitness is about the surgery, because we are in the field of surgery. So how to decide about and what are the criteria to decide about the fitness assessment for the surgery. Then, of course, fitness assessment for debility to have compensation in the courts and so on. So another essential area. And as an example, I will quote about the fitness required for the army. But for others, there is a need to study, and that itself is a very complex issue. Now, fitness for assessment of the surgery would be mainly by assessing the cardiac risk factors, pulmonary risk factors, cognitive dysfunction risks, and risks of difficult pain management. These are the 4 criteria by which the fitness is assessed. A standard protocol of fitness and grading these risks and coming to the conclusion would be, when depending upon the patient's characteristics, there are 2 methods of assessing the risk of surgery and suggesting about the fitness for the surgery. One is about the patient characteristics, and it's also about depending upon the type of the surgery which you do. And there are 5 scores for each. Now, very low risk is where there are no medical problems from the patient point of view. Low risks are patients who have hypertension, hyperlipidemia, asthma, and other chronic stable medical conditions without significant functional impairment. Intermediate, grade 3 would be when the patient is older than 70 years, non-insulin dependent diabetes mellitus, history of treated stable coronary disease, and obesity, anemia, and mild renal insufficiency. Grade 4 is when there is a recent coronary involvement and treatment, either medical or interventional treatment, or chronic cardiac failure, insulin dependent diabetes, renal insufficiency where the creatinine is more than 2, and obstructive pulmonary disorders where effective volume is less than or in between 50 to 70%. Patient having history of obstructive sleep apnea, history of stroke or ischemic attacks, and diagnosis of dementia, or patient with the chronic pain syndrome having very severe pain. And very high risks are unstable or severe cardiac disease, severe COPD, and where the patient requires a home oxygen, pulmonary hypertension, severe liver diseases, frailty, physical incapacitation. So this way, the patient factors are categorized into 5. Then the cardiac risk factors, again, we score them under, again, the scores of 4 in the 5 level. Very high risk is when the patient has a very unstable or severe angina, history of recent MI, decompensated heart failure, or valvular disease. A moderate risk is patients with 2 or more of the following conditions receiving a score 4 and 3 more conditions of a score of 5. History of ischemic heart disease, chronic stable heart failure, history of stroke or insulin-dependent diabetes mellitus, renal disease with the serum. And pulmonary risk factors, again, severe pulmonary disease score of 5 and moderate pulmonary disease score of 4. So that's how it's graded. Renal risk is most significant risk factor for post-operative renal failure is a pre-existing renal disease, and patients with a glomerular filtration rate of less than 60 ml or serum creatinine greater than 1.5 are assigned as a risk score of 3. So, and cognitive dysfunction test risks as such. High risk is when the patient has a current diagnosis of dementia or other cognitive disorder where the patient is not able to perceive the surroundings. Bedbound status and need for aid with activities of daily living, significant impairment of vision or hearing. Moderate risk is a score of 3 where the patient is having a frailty, age greater than 70. When I say frailty, the clinical frailty scale is usually adopted, and that clinical frailty score is based upon the scoring system of 9 scores. This is a universal scoring method. Clinical frailty for old age, and usually clinical frailty test is done for older age patients. And again, this has an issue with the compensation issue also, as well as some legal aspects also. Of course, it's graded from a very fit to 9 is terminally ill. In between, you may have a grading as such. Risk of difficult pain management, that fifth category is where the patient would have a risk score of 4. Risk score of 5 would be when the patient has a history with the chronic pain syndromes, high tolerance for opioids, or a history of substance abuse. Those who are addicted to the drugs as such, they are high risk. And again, there again you may have a subcategory, like if a patient is a drug addict, if the patient is taking more than 6 doses per day of hydrocodone, that's the drugs as such, or use of long-acting extended release of opioids such as Oxycontin, so on. So this way, the score is graded. Or surgical risk score based upon the surgery types. Now, another is the surgery type scoring, the type of the surgery. Very low risk procedures are procedures that usually require only minimal or moderate sedation and have a few physiological effects. Those conditions which can be handled with the local surgery, also considered local anesthesia, also can be categorized as well very low risk surgical procedures like GE surgery, endoscopy, dental procedures, etc. Where the score is 1. And score 2 is procedures associated with the minimal physiological effect like hernia repair, where you have to have a tissue handling for a bit longer duration, ENT procedures or diagnostic cardiac catheterization, interventional radiology, endoscopy with the stent placement, cystoscopy, etc. High risk are procedures with the possible significant effect on hemodynamics, where there is a significant blood loss, like colorectal surgery, transplant, etc. They are categorized as a high risk. Oncological surgeries are usually categorized as a high risk in grade 4. And very high risks are procedures with major impact of hemodynamics, where there would be severe fluid shift and possible major blood loss, like aortic cardiac surgeries, etc. Now, once you have this risk assessment, then the final decision about the fitness is based upon what we call as the final score of risks as such. A low risk is when the patient risk score is in between 1 to 3, and surgical risk score is within 1 to 3, and this green area suggests about low risk areas. Moderate risk areas where the surgical risk score is between 4 to 5 and the patient risk score is between 4 to 5, and that's the issue. Like, whereas patient risk score is more than 2, as well as the surgical risk score is 5, it's a very high risk, and this way the risk assessment is done. So, fitness for surgery, giving a certification about the fitness for surgery, which is a usually done job. Now, whenever the current protocols would require a patient, before planning for surgery, patient has to be referred to a physician, and then the physician has to give the fitness, which we generally do not follow. That's another issue. But the protocol, as per the current protocol, it has to be done. Now, when we do it, we assess the risk on the same parameters, based on the similar parameters, and decide by ourselves. We do not take a second opinion generally. So anyway, so that's the point. So when that second opinion has to be given, that taking the second opinion is based upon these standard protocols. So because it's a issue which is related with the surgery, I have gone into a bit more detail about this aspect as such. Then the next is the compensation issues. In the practice, you will come across this issue again quite frequently. A patient, a person who is disabled is demanding for compensation either in a court or with the government and so on. So there you need to give a certification about the grade of disability, how far the disability is there. It's again a sort of fitness. When there are no symptoms, it's a level 1, and the level 0. Level 1 is no significant disability, though the patient has symptoms but able to perform all his usual duties and activities, like a patient who has fever or so on, upper respiratory infections and so on, and where you give a fitness, this would be of that sort. Or patient having a chronic disease like diabetes mellitus, usually it's in the grade 1 as such. Then grade 2 is where there is a slight disability, where the person is unable to perform all previous activities but able to look after own affairs without assistance. Usually that old age issues, patients with old age and who have like arthritis like conditions, they are of the grade 2 of disability. Grade 3 is a moderate disability where the patient requires some help but able to walk without assistance. So that's the grade 3 in a severe degree of arthritis like. And grade 4 is a moderate or severe disability where unable to walk without assistance and unable to attend to own bodily needs without assistance, like patients with the paralysis. Severe disability where the patient is bedridden, incontinent and requires nursing care are grade 5. Now, from the legal point of view, whenever you give an opinion to a court about the disability of a person, you will be always following this scale, and this scale is quite popular as a ranking scale of fitness. Then another example, which just not from a practical clinical point of view, the maximum fitness is required for joining the army. And generally, you don't, as a practitioner, you don't get that opportunity to certify for a fitness to the army, because fitness to the army is decided by specialist fitness physicians of the army, and they have their own grades as such. Just as an example, where the maximum fitness is required, where the height of the person and chest expansion and hearing acuity, vision, or the illness is considered. In addition to that, there will be some performance assessment where a person has to run 1.6 kilometer run within 5 minutes and 30 seconds. Then he will be given 60 marks, and 531 to 545, 40 marks. Others fail. So those who cannot complete a 1.6 kilometer run with them before 5.45 minutes, they fail. Pull-ups 10 and above 40 in minute, pull-up in 1 minute, and less than 66 is failed. And then there is a balance test, and then 9 feet ditch test. These are the tests which are usually done. So not important from our point of view, just I have casually referred to is the theme is the level of fitness required for individual job is standardized in many opportunities. So whenever you give a fitness certificate for a specific job, you should know whether that particular job requires a fitness scale which is already predetermined or not, whether there is already a standard mentioned or not. For army, you are not supposed to give fitness as a general practitioner. General practitioners are not supposed to give fitness certificate to join the army. But whereas in the other jobs, there are many such situations where each job would have their own level of fitness, and that needs to be followed before you give a certificate of fitness. A general certificate of fitness may not be possible. So anyway, Sara Pariksha is actually assessment of the fitness. The next part is the assessment of the disease severity and the grading of the diseases. Now, grading of the diseases and assessment of the severity, we have already discussed in the previous chapters in terms of the ICD coding and DSM. And whatever Sushruta says is the reflection of the similar issue. So we will just casually go on word by word. व्याधिविशेषस्तु प्रागभिताः सर्व एव एते त्रिविधाः साध्याः याप्याः प्रत्याख्याश्च. The diseases are classified based upon the prognosis into 3 categories, where one which are curable and the other the palliative, and pratyakhya where the prognosis is poor. Pratyakhya means where the prognosis has to be explained to the patient and patient's party. Outcome would be extremely poor, but still you will manage. The difference between a yapya and pratyakhya is in the yapya, with the medical management, patient can be managed infinitely till such complications do occur. Pratyakhya is the condition where the outcome is extremely poor, but still you continue to have a management, usually where you will go for the real palliative treatment. Real palliative treatment, which we have discussed in the previous issue, like the end of life care. End of life care, where the target is not to treat the disease, but the target is to make the patient more comfortable. So that kind of an approach is a pratyakshaya. Or the other way, another method of examining the disease would be based upon whether there is a risk of the disease disseminating to others. तत्र एतान् भूयः त्रिधा परीक्षेत क्रियाम् औपसर्गिकः प्राक् केवलः अन्यलक्षणः. 1 minute. ಹಲೋ ಹೇಳಿ. ಹೇಳಿ. ಸರಿ, ಈಗ ನಾನು ಸ್ವಲ್ಪ ಈಗ ಒಂದು ನಾಭಿ ಒಟ್ಟಿ ಕೊಡಿ, ಮತ್ತೆ ಸ್ವಲ್ಪ ನಾನು ಬರ್ತೇನೆ, 8:30 ಬರ್ತೇನೆ. ಸರಿ ಸರಿ ಸರಿ. तत्र औपसर्गिको नाम क्रियाम् औपसर्गिकः प्राक् केवलः अन्यलक्षणः इति. Now the diseases can be categorized as औपसर्गिक, where there is a possibility of dissemination, epidemic or endemic sort of the disease, or pandemic, depending upon that. Janapadodhvamsa is a pandemic. The degree of औपसर्ग spreading is of any of those categories. प्राक् केवलः नाम तत्र औपसर्गिको नाम पूर्वोत्पन्नं व्याधिं जघन्यकालजातः व्याधिः उपसृजति तन्मूल एव उपद्रवसंज्ञः. औपसर्गिक also can be understood as a upadravajanya. Previous disease which can result in another complication is also upasargika. So upasargika word has two meanings, which can be disseminated, and the other is where a complication of a previous disease has occurred. Then प्राक्केवल नामः प्रागेव उत्पन्न व्याधिः अपूर्वपूर्वरूपो अनुपद्रवश्च अन्यलक्षणो नाम यो भविष्यद् व्याधिख्यापकः सपूर्वरूपसंज्ञः. Now certain of the disease symptoms, they have occurred and they would continue to be the same, like a patient of diabetes mellitus. It will be continuing the same. The complications of the diabetes which can occur, like a diabetic gangrene, is upasargika, and anilakshana is yo bhavishyat vyadikhyapaka, the possibility of a disease which can occur in future, which you can diagnose now by identifying many of the signs. That's the anilakshana. Pura Rupa Sanya, that's also calculated as Pura Rupa as such. So when a patient comes to you, you will be assessing like whether the patient has come in the early stage or in the later stages, advanced stages of complications. That's exactly the point of assessing that. Then tata sopadrovam anyonya virodhena upakrameta balavantam upadrovam va प्राक् केवलं यथास्वं प्रतिकुर्वीत अन्यलक्षणे तु आदिव्याधोक्तयेत. The approach to the management would be in the patient who have the approach to the management would be, if the patient is presenting with the complications, you will have to manage that patient with the anyonya avirodhena. When there are multiple diseases, the management would be considering all the other factors of the diseases, multiple diseases, and one treatment should not affect the others, and this way you will have to have a very careful approach. Balavantam upadramo, at times you will have to give a priority to one of the symptoms and one of the disease. The other disease may be left out for the next stage of this treatment. So planning of the treatment is a complex issue in the upasargika vyadhi. And prakkevalam ythaswam pratikurvita. In a prakkevala, where there is a single disease and the clinical signs are known, you have to follow the standard protocol of the treatment as per the disease. Anyalakshanetu adivyadho prayateta. In the patient who comes in the early stages, try to prevent the formation of the disease. Bhavati jata nasti rogo vina doshehi yasmat tasmad vilakshanah anuttamaphi doshanam lingaihi vyadhim upachareta. Even if there is no named disease, you may not be able to make a specific diagnosis. You may have to identify based upon the dosha lakshanas, and when you manage the patients with the dosha lakshana management, you will be treating that condition, and that's an advantage of Ayurvedic treatment. Many times you will not be able to name a disease, and even if you are not able to name a disease, still you can manage the patient based upon the dosha lakshana. That's about the pariksha, the disease related to the patient and the disease. Then the next is the Kala Pariksha. Praghavahitaha Ritavaha. Rutu and their signs are discussed earlier, and that again is a part of the assessment of a patient. Shita Pratikaram Usneta Usnaivaranam कृत्वा कुर्यात् क्रियां प्राप्तं क्रियाकालं न हापयेत्. Then depending upon the opportunities of treatment in the kriya kala as well as in the seasonal factors, Shita Pratikara. If there is a disease produced due to a Shita Guna and it's presenting with the Shita Lakshanas, you will have to give a Shita Pratikara. Ushna Guna Dravya has to be given, or Viruddhartaka Dravyas are to be administered. Ushneja Ushna Nivaranam Krutva Kuryat Kriyam Praptam Kriyakalam Nahapayat. You will have to see that the disease process doesn't progress further into the next Kriya Kala. The patient may come to you in any of the Kriya Kala, and Kriya Kala we have discussed in the previous session. So that's what we have to manage. And Aprapyava Kriya Kale, Prapyava Nakrita Kriya, Kriya Hina Adiriktava, Sadhyeshwapina Siddhyati. When you do a over-energetic treatment or a lethargic treatment. Over-energetic treatment is even before the right opportunity comes, you try to deal with the disease before the disease has been presented, or a treatment where the progression of the disease is not really tackled. Both of them hina atirikta, where either your approach is less than optimum or your approach is more than optimum. Both of them can make the prognosis worse. Sadhyeshwapi na siddhyati. So hence, the intervention in any of the patient should be timely, based upon the real-time assessment. Yahi udirnam shameti, nanyam vyadhim karoti ja, nasa kriya sa kriya natu vyadhim harati anyam udirayat. A proper treatment is a treatment which resolves the condition which is there and doesn't produce any other complication. That's the better treatment. The next part is about the assessment of the Agni. Praga abhito Agnihi annasya vachakaha. The Agni is discussed earlier. What is Agni? We have discussed that. Now, based upon the dosha lakshanas, the Agni could be doshana abhipannaha yakaha, where Agni which is not affected by the dosha is one variety. Then Vikriyamapannaha trividha. Abnormal Agnis could be of three varieties, and they are Vishamo Vatena, Tikshnaha Pittena, Mandaha Shreshna. Vishama, Tikshna, Mandagni. When there is a Vata Visheshan, the Agni becomes Vishama, and Tikshna when there is a Pitta, and Kapha, it results in the Manda. Chaturtaha Samaha Sarvasatnyaditi. Samagni is the normal, which is functioning properly. Tatra yo yathakalam upayuktam annam samyak pachati sasamaha. To confirm whether it's a samagni or not is when the timely taken food is digested in a proper normal manner. That's the samagni. Samehi doshe kadachit samyak pachati. That's even when there is a dosha involvement, it could be like at times the patient may feel like the digestion is normal. But the other way is Vishamagni, Kadachit, Adhana, Shula, Udavarta, Atisara, Jatara, Gaurava, Antra Pujana Pravahanani Katva, Savishamaha. When during the digestion, if the person has clinical symptoms like Adhana, distension, Shula, pain, or Udavarta, regurgitation, or Atisara, diarrhea like conditions, or Jatara Gaurava, heaviness in the abdomen, Antra Pujana, loud peristaltic sounds are heard during the digestion, then that's a sign of Vishamagni. Yet Prabhutamapi Upayuktam Annam Ashapachati Satikshnaha. Excessive food consumed also is registered immediately, then it's a Tikshna. Sayeva Abhivardhamano Atyagnihi Atya Abhashate. Atyagni also is named as another of the variety of the same Tikshnagni, where even after consumption of the food, there is still more appetite. That's considered as Atyagni. Saha Muhu Muhu Prabhutamapi Upayuktam Annam Ashataram Pachati. You give more food, it gets digested much more rapidly, which is also named as Bhasmakaroga later on. Pakanteja Galatalu Vosta Shosha Daha Santapanjanati. At the end of the digestion, you will have dryness of the mouth and burning sensation, etc. Then Yestu Alpamapi Upayuktam Udara Shiro Gauraba Kasa Shwasa Praseka Chardi Gata Sadanani Kratva Mahata Kalena Pachtes Mandaha. Mandagni is not able to digest the food in proper quantities, and during the digestion, the patient may have symptoms like udara, distension of the abdomen, headache, or cough, etc. That's the Mandagni. विषमो वातजान रोगान तीक्ष्णः पित्तनिमित्तजान करोत्यग्निस्तथा मन्दो विकारान कफसंभवान. Once there is a Vishamagni, it can result in Vata Vyadhi further. Now the controversy is whether the Vishamagni is produced to Vata Visheshan or Vishamagni produces Vata Vyadhi later. Both of them are true. Vishamagni is produced as a consequence of Vata environment, and once it has occurred, it can produce further Vata Vyadhis. Similarly, Pitta Nimitta and Kapaja Vyadhis can occur with the Agni variety as well. Tatra Same Parilakshanam Kurveta. In Samagni, you will have to protect the Agni by healthy habits. Vishame, Snigdhamla Lavane Kriya Visheshe Pratikurveta. Vishamagni, you will have to treat with the Batahara Dravyas, where you will have Snigdaguna, Amla, Lavana, Rasa Dravyas. Tikshne, Madhura Snigda Shitehi Virekeshta. That's the usual protocol. For the Pitta, you will have to use Madhura Snigda Dravyas. Evam Atyagno, similarly, Atyagni Visheshana Mahishesha Kshiradadhi Sarpirbihi. Mahishadadhi, buffalo, so milk and the butter, etc. has to be given. Mande Katutikta Kashaya Hivamaneshcha. In the Mandagni, Katutikta Kashaya Rasa Dravyas and Vamana could be given. Jatharo Bhagavan Agni, Ishuro Annasya Pataka, Sokshmya Drasan Adadanaha. Sokshmya Drasad Adadanaha, Vivektum Naima Shakyate. Now, Jathara Agni is a representation of the superpower in the body, whether you call it as God or something else. The capacity of the body, the digest is the real life in the body, and because it is very minute, it may not be visible as a separate entity. Vivektum na shakyate. It cannot be separated and cannot be shown as a separate entity. So you have to understand by its functions. Pranapana samane istu sarvat pavanehi tribihi dhyayate palyate chapi swam gatim avasthitehi. It's supported by, Agni is supported by the prana apana samana vata in terms of dhapana. Dhapana is a movement, palyate, supporting, and the gatim avasthitehi, swam gatim, regulation of the movement are the functions as such. That's about Agni Pariksha. The next is about the Vayo Pariksha. Vayastu Trividham, Balyam, Madhyam, Vruddhamiti. The Vayo Pariksha, age, deciding about the condition or prognosis of the disease based upon the age, is categorized into Balya, Madhya, and Vruddhavastha. Tatra Guna Shodasha Varshiyaha Balaha. According to Ayurveda, up to 16 years, the condition is considered as Balya or pediatric. Present criteria is 12 years. 12 years is considered as pediatric, about 12 years is under adult medicines. Then Balya is again categorized into 3 categories: Kshirapaha, Kshiranadaha, Annadaha. Usually Kshirapaha is where only milk is given, usually under 1 year. Kshiranadaha, where both milk as well as other food is given, solid food is given, 1 to 4 years. And Annadaha, after 4 years, it's only the Annada. That's how it has to be categorized. It's not a very rigid like 1 year, 2 years. It could be depending upon the food. So depending upon the type of the food, you will decide about the capacity, and that's very scientific. Tatra Samvatsaraparaha Kshirapaha. Generally, Samvatsaraparaha Kshirapaha. Up to 1 year, it's the Kshirapa. Div Samvatsaraparaha Kshiranadaha. Up to 2 years, it's the Kshiranada. Parato Annadaha. Beyond that, it is the Annada. Shodasha Saptatyoha Antare Madhyam Vayaha. Madhyam Vayasa is in between 16 to 70. Now, this is in those days where the expected life period was 100 years. The Saptati up to 70 is considered as Madhyavaya. In the present day situation, we generally consider the geriatric practice as above 60. Above 60 is a geriatric in the present day situation. So that categorization is based upon the status of the society or status of the people's health and expected life period in the real-time situation. Now, in Sushruta's period, it was up to 70 years considered as Madhyamaya. And again, there will be categorization as Vruddhihi, Yavvanam, Sampurnata, Parihanihi iti. The Madhyama Vayas would have again 4 stages: Vruddhi, Yavvana, Sampurnata, Parihani. Tatra Avimshatehe Vruddhi, up to 20 years is considered as Vruddhi, where there will be always a higher proliferation. Growth is seen. The person you will be able to assess the growth in terms of the height and weight. Atrimshatoho yavanam. The up to 30 years, 20 to 30 years is yavana where there will be a stability, there will stable and there will be a gain in muscle tone and functions as such. Asatvarimshatah sarvadhatu indriya bala virya sampurnata. Up to 40 years, there will be maturity, the stage of maturity, where the person will have reached a maturity and there will be no further growth, but the same strength is sustained. Ata urdhvam ishat parihanihi. Beyond 40 to 70, there will be a gradual deterioration. There is a tendency for the gradual deterioration. So if you have a graph, that graph can represent in the first Avimshati up to 20 years, it's a rapid height, and then there is a gradual flat, and then there is a gradual descent as such. Saptateha urdhvam kshiyamana dhatu indriya bala viryotsaha ahanyahani वली पलित खालित्यजुष्टम कास श्वास प्रभृतिभिः उपद्रविः अभिभूयमानं सर्वक्रियासु असमर्थं जीर्णागारमिव अभिभ्रष्टं असीदन्तं वृद्धम् आचक्षते. Vruddha is beyond 70, where there is a very rapid deterioration of the physiological functions, and the patient's vigor also is reduced. You will be able to see the skin getting wrinkled and the baldness and so on. The clinical signs of the senility are seen, and the patient is more prone to have respiratory difficulties or other diseases which are related to the age can be seen. And Sushruta compares them into Jirnagaram Abhivrastam, looks like a very old house. तत्र उत्तरासु वयोस्थान वयो अवस्थासु उत्तरोत्तराः भेषज मात्रा विशेषाः भवन्ति ऋते च परिहाणेः तत्र आद्यापेक्षया प्रतिकुर्वीत. Now when you prescribe the medicine, you will have to prescribe the medicine which are suitable to that particular age. The dose of the drug has to be increased up to the level of parihani, that's up to the middle age. At the beyond parihani and then the old age, either the dose has to be reduced or depending upon the status, you will have to decide about the dose. Bale vivardate shleshma madhyame pittamevatu bhuistam vardate vayu vruddhe tadvikshayodeyat. In general, in children, it is the kapha vyadhis which are more prominent. In the middle age, it is the pitta vyadhis more prominent. Vruddhavastha, it is the vata vyadhis which are seen more prominent. अग्निक्षार विवेकेस्तु बालवृद्धो विवर्जयेत तत्साध्येषु विकारेषु मृत्युं कुर्यात् क्रियां शनैः. In very young age and very old age, Agnikshara Vireka, such rigorous treatment should be avoided, and you will always have to have a Mrudhi Kriya, a relatively soft as such. Deha, then the next is a Deha Parisha. That's again categorized as a Stulaha, Krushaha, Madhyama, Iti, Pragupadishta. This is already discussed in the previous chapter about the body conditions, and we have discussed that in detail. The general approach is Karshayat Brahmayat Chapi Sada Stula Prashaunaro, Rakshan Deva Madhyasya Kurbita Satam Bishaka. A Krusha patient, weak, emaciated patient should be given supportive treatment to enhance his weight, and whereas a Brahmita, a obese patient, overweight patient, the weight has to be reduced, and Madhyama, optimum weight, it has to be protected. Balam abhita gunam daurbalyam tu swabhava dosha jaradibhi apekshidavyam yasmat balavatat sarvakriya pravurtihi tasmat balameva pradhanam adhikarananam. Bala is the physical strength, or stress tolerance is the asset, and the stress tolerance could be again categorized as a balashali and durbala. Daurbalyam to swabhava dosha jaradibhi apekshidavyam. How to assess that would be by looking at the personal approach, dosha, the disease signs, and the age. These are the factors which can produce the bala, or which can affect the bala. And yasmat balavataha sarvakriya pravurtihi. In a strong, physically strong patient, the treatment would be relatively easier, and hence you can have a full-fledged treatment. When there is a lesser bala, then you will have to have a planned management according to the tolerance of the patient. Kechit krushaha pranavantaha stulascha alpabalaha naraha tasmat sthiratvam vyayamihi balam vaidya pratarkayat. Now, bala is not assessed by only the body size. There are many looking thin persons could have more strength, whereas persons who look obese or look stronger, they may have lesser bala, and hence bala always has to be assessed by exercise tolerance. Persons who are physically fit, their fitness is assessed by the exercise tolerance, but not by the looks alone. That's the important part. Sattvam tu. Sattvam is an intellectual capacity or emotional capacity. Sattvam tu vyasana abhyudaya kriyadi sthaneshu aviklavakaram. Sattvavan sahate sarvam samsabya atmanam atmanah rajasastabhyamano anyehi sahate neva tamasaha. Again, it's an intellectual stress tolerance, where the person, how he would react to the stress. A person who reacts to the stress very stably without getting affected by the stress is Sattva. He is Satvika. Rajaha Stabhyamana. Rajasa gets confused to a certain extent when there is a stress, whereas Tamasa doesn't tolerate the stress at all. So Sattva or capacity is a mental capacity. Is considered categorized into three categories: Satvika, Rajasika, and Tamasika. And Satvika, Rajasika, Tamasika different personalities are a very standard protocol in Indian mythology. In Gita, Bhagavad Gita also, you will have lots of information. I will just not go into that. Satmyanito, then depending upon the food habits and something which we are conditioned. Conditioning is Satmya. A person who is conditioned to a certain habits is the Satmya. Satmya is Desha, Kala, Jati, Rutu, Roga, Vyayama, Udaka, Diva, Swapna, Rasa, Pravritini, Prakriti Viruddhanapi, Yani, Avadakarani, Bhavanti. Because of that continuous exposure or conditioning, even if the otherwise the environmental factors or the disease conditions or maybe the water and the exercise may look to be non-congenial, person may get accustomed to that. So accommodation or accustoming is one. Like a person who is living in Udupi, he may be accustomed to this sweating and hot environment. Person who is living in northern countries, he may be accustomed to that cold environment over there. So, but for that person, there is a Satya. But the same, a person who is in that cold status comes to a hot environment, it becomes a Satya. So Satya is decided by the conditioning and the how you get accustomed to that accommodation as such. Yo rasam kalpate yasya sukha eva nishepitaha vyayama jatam manidvad. It could be even related to the food, person, vegetarian, non-vegetarian, and so on. So food habits, environmental factors, these are all the factors which decide about the Satya. And whenever you plan the management, you have to consider this factor also. Yo rasam kalpate yasya sukha eva nishepitaha. Vyayama jatam manyatva tatra satyam nirdisheta. Whenever you suggest any treatment, you have to consider the Satya. Prakriti Bheshad Uparishta. The Bheshada and Prakriti will be discussed in the coming chapters. Deshastu, now Desha Pariksha. In the next chapter also you will have more of the Desha Pariksha. Deshastu Anupaha Jangalaha Sadharaniti. The categorization of the Desha, environmental factors, is categorized into three categories: Anupa, Jangala, and the Sadharana. तत्र बहुदक निम्न उन्नत नदी वर्षगहनः मृदु शीतानिलः बहु महापर्वत वृक्षो मृदु सुकुमार उपचित शरीर मनुष्य प्रायः कफवात रोग भूयिष्ठ च आनुपः. Anupa is where there is plenty of water and the rivers would be more seen, there will be more rain, and the surface of the land is uneven. There will be some low areas, high areas, and so on, and there will be plenty of trees, something like a forest-like situation. And in these areas, the living persons would be more delicate, and their body would be upachita sharira. That's their body would be fully nourished as such, and there is more incidence of kaphaja and vataja bad, like our coastal area. It's the Anupadesha. Akasha samaha pravirala alpa kantaki vriksha prayah अल्प वर्ष प्रस्रवण प्रस्रवणात् पान उदक प्रायः उष्णाद अरुणवातः प्रबल अल्पशरीरः स्थिर कृश शरीर मनुष्य प्रायो वातपित्तराग जांगलः. Jangala is the area where there will be lesser rain and the plants also are lesser, and plants would have more thorny, something like the desert areas where there will be very hot environment and you will not have mountains, etc. Plants also would be lesser. Such a condition is Jangala, like the your desert area, Rajasthan and so on. Ubhayadesha Lakshana Sadharana. Sadharana is where you don't have too many rains as well as the not very dry environment like the Malnad area. समाः साधारणे यस्मात् शीत वर्षोष्णमारुताः दोषाणां समता जन्तुः तस्मात् साधारणतः समादेश is our साधारण देश is where the शीत वर्ष both cold as well as the hot season are very balanced. Rain is balanced and hence there will be doshanam samata. न तथा बलवन्तः स्युः जलजाः यस्थलाहृताः स्वदेशे निश्चितादेशाः अन्यस्मिन् कोपमागताः उचिते वर्तमानस्य नास्ति देशकृतं भयम् आहार स्वप्नचेष्टादौ तद्देशस्य गुणे सति. A person who is accustomed to that particular area zone need not be troubled or will not be troubled by the environmental factors because he is conditioned. So hence uchite vartamanasya nasti deshakrutam bhayam. If the person is following the lifestyle which is suitable for that area, then there will be no problem. But if you go by the other way, if you try to follow the lifestyle of others, when you copy the lifestyle of the West in the East, then there is a possibility of the disease process. If you follow the lifestyle which is the standard lifestyle for that particular zone, there will be no disease. It's a very important factor, very important concept where generally what happens now is because of the westernized culture, we follow all that westernized culture, westernized food habits, type of westernized living, and that would be more harmful than if you get accustomed to the conditioning here. देश प्रकृति सात्म्य ऋतु विपरीतो अतिरोत्थितः संपत्तौ विषगादीनां बल सत्त्वायुषां तथा केवलः समदेहाग्नेः सुख साध्यतमो वदः अतो अन्यथा तो असाध्यः स्यात् कृच्छ्रो व्यामिश्रलक्षणः. So ultimately the prognosis of the disease is based upon multiple factors. It's not a single factor. You will have to consider all these desha, prakriti, satmya, rutu, etc. as well as the other factor which decides is the chatushpada, kriya chikitsa chatushpada, capacity of the physicians, the quality of the patient and the medicine, etc. And when all these factors are supportive, then the disease will be curable. Otherwise, the prognosis can change. क्रियायास्तु गुण अलाभे क्रिया मन्यां प्रयोजयेत् पूर्वस्यां शान्तवेगायां न क्रिया संकरोहितः. Whenever you follow one line of treatment, you will have to follow that line of treatment up to a reasonable limit. Only when you are sure that that line of treatment has not produced the results, you change the line of treatment. Like suppose you start with the Shodhana, Karshana Chikitsa, and suppose it doesn't show the result up to a certain extent, then you go for the Brahmana Chikitsa. You are not supposed to give multiple lines of the treatment, Karshana and Brahmana together, or Ushna and Shita together. That should not be given. Kriya Sankaraha should not be done. And it's a very, very important and delicate issue in the clinical practice. We will discuss about these issues in due course of time when we get more opportunity of dealing with the disease and disease management. Guna alabhepi sapadi yadi saiva kriyahita kartavyeva tada vyadhi krita sadhyatamo yadi. If the patient's disease condition is such that even after your effective treatment, you do not expect a proper treatment, you should not change the line of treatment. If you are very sure that your line of treatment is correct, you will not change the line of treatment if the disease is such a state where you do not expect the results. या एवं विधिं एकरूपं बिभर्ति कालादिवशेन धीमान् समृत्युपाशानि जगतो गदौघं छिन्नति भैषज्यपरश्वधेन. Now, an efficient physician who considers all these multiple factors, then he only can be very successful practitioner. Sushruta describes that physician as a person who can supersede or who can win over the death with the Bhaishya Parashu. The Bhaishya, the medicine is compared to a weapon of the physician, and he can win over the Gadaugha. Now, in Charaka, the same factors are discussed with the different words as such, but the meaning is same. In the Charaka Samhita, the Atura Pariksha, where the Pariksha is Ayusha Pramana Jnana Heto Sayada, Baladosha Pramana Jnana Heto. The Pariksha is considered for the same person or same reasons, and the words used are different, where प्रकृति प्रकृत्यतः विकृतितश्च सारतः संहनतश्च प्रमाणतश्च सात्म्यतश्च सत्त्वतः आहारशक्तितश्च Vyayama Shaktitah Vayastashyati. It's the same issues, but the words are different, sequence is different. There is no difference of opinion. इति सुश्रुतसंहितायां सूत्रस्थाने आत्मोपक्रमणीयो नाम पञ्चत्रिंशोऽध्यायः. With this, we will wind up today, and if there are any questions, I will try to answer, and then we end up. Right, there are no questions. We will close it now. So.